The County Suicide Prevention Council released its annual report on the status of suicides. Last year, the county recorded a total of 419 deaths by suicide. That number is lower than the previous year, with a total of 429 suicide deaths. Mental health experts with the county say suicide is one of the few leading causes of death that is preventable. County Supervisor Nathan Fletcher says erasing the stigma associated with mental health is where it begins.
To get to a place as a society where people are just as comfortable getting help or treatment for depression as they are for diabetes. A place where we recognize that schizophrenia is not different than high blood pressure.
This year, the county made efforts to improve crisis response by dispatching behavioral health experts to emergency calls instead of law enforcement. The county also outlined the benefits telehealth platforms have created by increasing access to services during the pandemic. The county behavioral health director, Dr. Luke Bergman, says the pandemic exposed the inequities correlated with mental health.
Rates of psychological distress among people in lower income brackets are especially high, both during the pandemic and in previous years.
Across demographics, Bergman says psychological distress was 200 times worse amidst the pandemic. Severe depression also skyrocketed.
And rates of severe depression are 500% higher than prior to the pandemic.
Bergman says the most important thing we can do is check in with others.
We know that the conversations most likely to prevent a suicide are those among family, friends, and social networks.
If you or someone you know needs help, call the Access and Crisis Line for support at 888-724-7240. Alexandra Rangel, KPBS News.